Chantel Foster is here to speak to us about the options around senior housing and care. Chantel is the resident life director at St. John's Meadows and Brickstone by St. John's. She has extensive experience in geriatric care management and 20 years of social work experience in hospitals, community organizations, senior housing, care facilities, and skilled nursing. Chantel is a certified dementia coach who is very active with the Alzheimer's Association and an elder advocate for senior housing at St. John's Meadows and Brickstone by St. John's. A big decision we need to make as we age is, do we want to stay in our home or look to senior housing and care options? Chantel, most of us are familiar with the term nursing home and tend to shy away from it. What we are not familiar with are the options that are actually available to seniors for housing and care. Can you review these options and their differences? Is there a difference between the continuum of care communities and independent for-profit communities?
Mm-hmm. Absolutely. I have the joy of working in a continuum of care community. I'm working at St. John's for about 6 years, and I work in an independent living community, but I also work a little bit in our assisted living. Rochester has just so many options for senior housing. And so when I've met with many families over the years and with individuals who are looking at options, there's so many factors to take into account, and sometimes it just seems very overwhelming. There's a wonderful resource in our community through Lifespan that offers you a wonderful opportunity to go on their website and look at all of the communities that are out there. And if you go to eldersource.org, that's where you'll find information on their page. But as we talk through different options of housing, I'll go into it a little bit as far as what it looks like, what the prices are, and I'll speak from my experience in my community as well about the amenities, and hopefully we'll be able to answer many of your questions. But first, when we think about moving to senior housing, what drives us to make that decision? There's many things I hear from the seniors that live in our community. Most of them, I hear them say one of two things: that they have a decreased social network. They have become more isolated. Maybe it's transportation. Maybe it's that their friends have moved on to other levels of care, or they've lost their friends, or their children live out of state. And so they find that their social network has changed and their social opportunities are different. So making a move to senior housing, to experience more activity and growth and learning is a really important part for them, making connections again and new friends. But also we see people, secondly, coming in more for challenges and just caring for their homes, their property, dealing with the winter snow, all the things that we have to deal with here in Rochester. Sometimes they may be caring for a spouse, and the burden of caring for the home in addition to caring for their spouse is just becoming greater. And as Mary spoke to, we need to take care of ourselves as caregivers, and so sometimes moving into an independent community can afford us, more opportunities and take off some of the burdens of caring for our home. Transportation and meal supports are also often a very common need for people as they age. It's more difficult to prepare meals, to get to meals, and transportation is always an important factor for people if they have to give up their car and make those very difficult decisions. Some of the quotes that I have captured over the years from seniors about moving and why they did, one of the things that always sticks with me is someone said to me, "Plan before you planned to." And we all say, someday I need to look into these options, but it's important to look at them, like Mary spoke to us, when we're not in a crisis, when we have the time to look around and to make, really educated decisions. Someone also said, moving isn't for wimps. And it's true, you want to move when you can, not when you have to. And it's become maybe a more physical burden for you at that point to make a move. And also acceptance. Acceptance is really what all of this decision making is about. So one of my residents also said, I also never wanted my kids to feel that they were the only supports that I had, that if I moved into a community like this, that I would be able to, access more supports, talk with staff, have the resources that I needed so that I wouldn't be, only relying on my children. And so that was important too. When we talk about a continuum of care, you may not fully know what that means. Maybe some of you do. A continuum of care is really a system. It's different communities within a healthcare system that allows you to have priority access to one level of care to another as you need it, as your needs increase. And you have that priority versus if you're in an independent standalone community that is more often a for-profit community, those are isolated housing options, so you don't have those connections to other layers of care should you need that. So in a continuum of care, I tend to steer many people to that because you have what you need when you need it, and you have priority to it. Independent for-profit communities may have a wonderful sticker price. They might have a nicer, lower monthly rent. However, the amenities are less. You get what you pay for. So the amenities may be less. And also a lot of times independent communities are not, community-based. They may be owned by a company that is not here from Rochester. They may be a chain community, and the investment in the Rochester area is not there. We, through St. John's, we were founded in 1893. So we've been part of the Rochester community for a very long time. So I think that that's really important to consider as well. So when we talk about a continuum of care, it's traditionally an independent living setting and an assisted living setting, a skilled needs assisted living or a memory care community, a nursing home or a greenhouse home, which I'll talk a little bit more about this in a minute, rehabilitation, an adult day program, a social or medical model day program. When we talk about independent living, that's where I work at St. John's in St. John's Meadows in Brickstone. We have over 500 residents. We are the largest senior community, and we have a lot of options. And housing today, that's what it's all about. Choices, the lifestyle that you're looking for. Senior housing providers know that, and they want to meet the needs of people coming in and their wishes and their desires. So we are changing, and we're thinking ahead of the next generations that are coming to us and what they will want. We're teaching classes on iPads and iPhones. We have partnerships with Lyft. We're thinking ahead for folks that are coming to us in the future. But there's a lot of options: apartments, cottages, townhomes, bungalows. It's really whatever you want. You can have access to those things. Amenities, many amenities, and especially in a continuum of care. Meals, of course, dining areas where you can have 3 meals a day and snacks. Of course, the basics of life, your cable. Everyone wants that, your Wi-Fi. But of course, there's recreational programming and connections for volunteers. And that's really the heartbeat, I think, the pulse of most of senior housing. Our residents that live at St. John's, they impress me. Sometimes they have to choose from 3 things on a given day at a certain hour because they're just so involved, And that's what we want. All of us want to be able to remain to be who we are, to continue to grow, and to be learning. So we work closely, as many communities do, with local colleges and trying to bring in as many programs as we can that are meaningful to the residents. So in addition, in a continuum of care, you'll see also resources like spiritual care. And you'll see a larger breadth of staff. In our community, we have an elder advocate. I served in that role for 6 years. This is typically a social worker or a nurse that can be supportive to give guidance as you may come with questions, as you have changes in your health, as you may want to look at the other levels of care in the continuum. So that's a nice resource. Our community has been in existence for 21 years, and Brickstone has been in existence for about 6 years. So we feel we offer a lot of great services in our independent housing. Apartments in a not-for-profit continuum of care, just for maybe what you would call an a la carte package, which is you pay for what you need or what you want. You can anticipate anywhere from $1,700 to $2,800 a month for a monthly rent like that. In a for-profit standalone community that I was speaking about before, that can typically be anywhere from $1,100 to $2,000 a month. They may offer things like transportation. They may have some meals available to you, but they typically don't have the amount of amenities that a larger continuum of care offers. So doing your homework when you're looking at senior housing, most people think geography. Is this close to my children? Is this close to my doctors? You know, making it as easy as possible for you and your family. Taking several tours, experience a meal, make a phone call to the front desk. How does that experience feel when you walk through a community? Look at the residents and their interactions with the staff, with each other. You know, does this feel like a welcome environment, a warm place that you could feel like you fit in? And checking a little bit about the credentials. There's a website out there when you're looking at a continuum of care and you want to look at the higher levels. There's a website available through Medicare, medicare.gov, Nursing Home Compare, and it gives you insight into the nursing home that's part of that continuum, the quality measures, different things like staffing that can help you. As you know, when you're entering a continuum of care, you may need those other levels. So do your homework and look at those other levels of care within the system. Also ask questions about the pricing. What is available? What's a la carte? What's not? Do they have bundled packages, meaning that they'll incorporate meals and transportation and things like that into their monthly rent? Is that an option? And are there affordable housing options should my finances change? If my spouse that I come in with passes away, or if they require a higher level of care, what affordability is there for me in those life changes? And finally, I think it's most important as we talk about planning to talk to people that are working with you in your care plan. Like these ladies said, talking to your doctor and maybe folks that work with you now, healthcare professionals, to make the right decision. Is independent living the right situation for me, or should I be looking at a higher level of care? And assisted living, it's such a complex system, assisted living. So maybe you've heard of the many different options that are out there. Assisted living has many acronyms, and it's very overwhelming for the average layperson. You'll hear enriched living. You'll hear enhanced assisted living. You'll hear skilled needs assisted living. So what are all of these communities, and what do they offer? In your packet, I put a grid that will give you information about all the different types of assisted living communities and what services are offered. And this came from our Senior Housing Alliance, which is a great group to give resources to social workers and families in the community. But assisted living actually was really changed in about 2004. Many communities said that they had assisted living, but they were not all the same. They were not all providing the same services, and they were not licensed. And in New York State in 2004, they said, we really need every facility to be licensed. We need to ensure that certain things are happening in each facility. So assisted living went through a big change. And right now, when you call yourself assisted living, you have to have on-site 24/7 monitoring. That may or may not be a nurse. That may be a care provider, a home health aide in that facility. You have to have personal care services, help with grooming, dressing, bathing, case management, housekeeping, and medication assistance, activities, and recreational opportunities. It's important if you or your loved one are looking at assisted living, when you go in and meet with someone in the admissions office, that you talk about, when you look at that flat price, that monthly rent, is that really what I will be paying, or will I be paying for more care in the future with my bill going up because I'm needing a higher level of care within that facility? So is there a per hour increase, or is there an increase as I need more support for medication management? So they oftentimes will increase by tiers of care, and your monthly rent will go up. Or are you looking at an all-inclusive package that offers anything and everything when you need it, and that monthly rent doesn't change? At our community, we have an all-inclusive package. We offer the highest level of care. It's called an enhanced assisted living. When you look at assisted living today, you'll hear that the price can range anywhere from $2,000 to $6,100 a month. And again, that all really depends on the type of facility that it is, what it's licensed to do. An enriched housing facility is the lowest level of care. There are some of them still in Rochester. Mostly they are private pay. However, some communities offer assistance with SSI. So there are some options for affordability in the community. But enriched living is really the bare bones of what assisted living provides. Meals, care management, yes, medication support, possibly, and some personal care. So it's probably not always the best option for someone when they need a higher level of care. The traditional assisted living communities, you will find them being more anywhere between the $3,500 to $4,500 per month range. An enhanced assisted living community will be anywhere from $5,000 to $7,000 a month. So let me just go in a little bit deeper about what that looks like, what enhanced assisted looks like. It's actually a facility that has applied for licensure for additional certification that permits their residents to age in place. The residents receive a substantially higher level of care provided than in a traditional assisted living. So it kind of bridges the gap between a traditional assisted living and a nursing home, with the hope that the residents that move to that facility will be able to age and hopefully, may not even require the nursing home level of care. So each facility that operates as an enhanced assisted living can apply for different types of services that they can provide. Those are typically nursing or medical-based services. So one facility may provide assistance with diabetic management, providing insulin, oxygen, Foley catheter support, many different things, incontinence care, and each facility licensed for different support services like this. So that's very puzzling to the average layperson who walks into an assisted living facility. Are you a traditional? Are you enhanced? What are you licensed to provide as an enhanced facility? So oftentimes, social workers are a very good support and guide to you, as well as your physician. They know about the communities that are out there and can give you the wisdom that you need to make the right decision based on your needs at that time. A skilled needs assisted living residence is a memory care assisted living community. So you've probably heard of that. And typically, again, this is a higher level of care that's provided for a resident that has a diagnosis of dementia. They have a higher staffing ratio. They are typically a secure environment, so it's there's no possibility of someone wandering out. Also, they may need to deal with someone who's awake 24 hours, someone who might need support at night with activities or care. So they have a higher level of staffing and a higher level of support to a person. So you will be paying more for the higher level of support that you get. That can range anywhere from $6,000 to $8,000 a month. Yeah. In any assisted living community, you need to have, in order to be admitted, you need to have a doctor's certification that you need that level of care. A lot of times when I work with families, a lot of people will say, gosh, all of a sudden we're needing so much more help, and we're in this independent setting now, and we're bringing in so much care, and it's getting more and more expensive, and it's unreliable because sometimes the aides are not showing up as we planned, or we're not able to take mom or dad to the doctor today. Now, what do we do? In an assisted living setting, a lot of that worry is taken away because you have the 24-hour care support available. You have a team that arranges those appointments, arranges those doctor's visits and transportation for it. There's no worry ever that you're not going to have the care you need because it's 24 hours a day. So a lot of times when people will need to be faced with making a decision about assisted living, it's because they are finding that the home care plan in their own home or in an independent setting is just really becoming too much. It's too much of a struggle to find good, reliable care, and possibly sometimes the cost of the care that you're bringing in home is getting so high that it's almost parallel to what an assisted living price would be per month. So one of the biggest factors is you can't always plan for the care that you need. So if I'm living at home and it's becoming more difficult for me to get up and down or, and or get to the bathroom, you really can't plan to have an aide come when you need it, right? On a whim. So unfortunately, a lot of times that's when, families and individuals are faced with a decision for assisted living and or when they need a higher level of nursing support than what can be provided at home. Skilled nursing. So nursing home care is changing. And it's hopefully going to be in a better way. I've worked in long-term care for 13 years. I know when you first mentioned, Elizabeth, about nursing homes and how many people say, I hope someday I don't have to go, right? Nursing home care is changing, and you can have hope in that. Many people are working to change that. There's some really great things happening in nursing home care, and St. John's actually started the first greenhouse home in Rochester. And if you aren't familiar with that, it's kind of going back to the roots of where nursing homes started. Back in the late 1800s, when typically religious groups and women felt that people who were aging needed a safe place to reside, and built a home for them. A small, they purchased a home and they put care in these homes, and it was an intimate, small setting. Nursing homes are going back to that because that's what we feel and believe we all deserve. The larger institutional setting that we've all experienced for years is changing. And those buildings that you see around Rochester that are nursing homes, many of them are, actively planning and breaking those traditional institutional ways down. You'll find often when you walk into a nursing home today, there will be neighborhoods. There will be smaller sections where residents live, where they're provided with the 24-hour care that they need. So be hopeful. If you walk into our neighborhood at St. John's Home on 150 Highland Avenue, you'll see a very big building, but you'll walk in and see that many changes are happening. Our greenhouse homes are in Penfield. This is what drew me to St. John's. They are just impressive. They're amazing. They look like your home when you walk into it, with a dining table where the residents and the staff eat together. They make the meals together. And I have a funny story. When they were first building the greenhouse homes, they were delivering the mattresses from City Mattress. And the gentleman pulled up with the delivery truck and knocked on the door and said, "Where's the nursing home? This doesn't look right." So nursing homes are changing for the better. So we are an Eden Alternative facility as well, which really gets to the heart of really what we believe that every person deserves, that every person deserves the right to have choice and dignity as they age and spontaneity. So when you're in a greenhouse home or a small home anywhere in Rochester today, you'll see, residents make their own decisions about when they get up, what they eat, what they want to do for the day. It's all more about them and less of the system and the facilities decisions and choices. Nursing home care is a 24-hour-a-day operation, right, with a physician available to support you. And this is typically when you need, quite a bit of medical and nursing care. And transitioning from assisted living to nursing home, it's typically when we no longer can meet your medical needs or you need more medical monitoring than what the assisted living can provide. So nursing home care, yes, you're receiving the highest level of care, so the expense is a lot more. Typically, you'll find the average rent from nursing home is $14,000 to $15,000 a month right now, and that may come by surprise to many of you. That's where we are today. When I started, 13 years ago in nursing homes, it was around $250 a day. Now it's somewhere around $450 to $500 plus per day. So just so you're aware of the expenses in that. Who pays for all of this, right? Private pay, long-term care insurance. Where does Medicare fit into all of that? Housing, I think most everyone knows Medicare does not pay for housing. Medicaid may pay for housing, but traditionally it's private pay. And long-term care insurance can supplement and support assisted living and nursing home expenses, not your independent housing, but long-term care insurance can cover your home care needs in your home, potentially, if you qualify. So in a nutshell, when you're looking at the communities that you're considering, think long-term, think about your future self, think about your family, your support system, and think about the type of lifestyle that you want to have. And when you look at these communities, find the right feeling. Does it feel right to you? And when you're looking at the nursing homes, find the communities that have the heart. Find the nursing homes that have heart. Talk to the administration, see where they're headed and what their direction and their goals are for the future. I do have a lot of hope for nursing homes, and I'm working every day in senior housing. I hear wonderful stories from the residents in our independent setting and in our assisted living setting. They have a good quality of life. They have more fun than I ever thought that they would when I started this job 6 years ago. And it's all about, your ability to continue to be who you are, to have the support system in place. However, when as you age and when your needs change. Thanks.
Thank you, Chantel.